Hey everybody, it's Jenny Harper Road, owner of Balanced You, and I have a special guest here today. I'm really excited to be here with Rochelle Walsh. She is an amazing lady with a skill that I think a lot of you are going to want to tap into and learn from her and listen. So I'm going to let her do a little self-introduction, and then we're going to dive into her story and her expertise and how she can help you live your best life. So Rochelle, tell us a little bit about you and what you specialize in.
Thanks, Jenny. Thanks for having me here. Yes, as you mentioned, I'm a clinical social worker and I've been in practice for 20 years. And my specialty is really trauma and anxiety and using brain-based strategies to help calm the nervous system. So I'm right here in the Midwest and I have a clinical practice and I have online programs. And personally, I've been married for over 25 years and I have 3 kiddos. And a lot of our journey has been kind of, as most people's, professional and personal intertwined. And so I like using what I've learned both, my training, my skills and my training, and also through some, what I've learned in my personal life to help clients just break free from anxiety and be able to live in the freedom of their own mind.
I love that. I love all your specialties, and you've been doing it for a long time. So you're not a new kid on the block.
Right.
You've been around, you know what you're doing, even though you look young and beautiful. You've
thank you.
learned a lot and decades of practice and working with people. So you said anxiety and trauma are your specialties?
Yes.
Why did you go there? Why did you specialize there?
Really years ago, my son had some PTSD from a car accident we were in, and I ended up taking him into an EMDR therapist. At that time, I'd been practicing for about 12 years and did a lot of cognitive behavioral therapy and really, and a lot of marriage at that time, and took him to an EMDR therapist, which is eye movement desensitization and reprocessing. He was 6 years old, and it really helped him. And I was just fascinated by how quickly it worked to just change that neuro pathway in his brain that was overexcited. So I started doing a lot of trauma work, and then I just became more and more fascinated and started learning about childhood trauma and how that impacts the nervous system and the brain. And so that just really became a passion. So for the last 12 years in my clinical practice, EMDR has been my specialty. So the people I get are almost always have some layer of trauma or childhood experiences, adverse childhood experiences have led them to have a lot of emotional dysregulation, and anxiety just naturally comes from that. So I would have people who knew there was an immediate trauma, something that had happened, and it was more PTSD. And then I would have people that have just had the long-standing chronic anxiety or emotional dysregulation and didn't really understand why. And so my path, as that evolved and I started doing more trauma, I stopped doing marriage and CBT because I just found that for my preference in treating clients and what I was having success with in my clinical practice was just a lot more direct route to getting people the alleviation of their symptoms.
I love that. So when somebody has anxiety, it feels like an epidemic nowadays. Like, of course, COVID didn't help. Right? Stuff going on in the world, but to me it seems like a lot of teenagers as well struggle with this even before COVID. And so I'm curious, like what do you teach your clients to deal with their anxiety when they're not like in office or on Zoom working with you? A few tips or tricks of what do you do to calm yourself down when you're feeling uncomfortable and anxious and worried and you don't know how to stop that feeling?
Right. And you're so right. Even before COVID, I believe it was March, like kind of right as COVID was starting. I think it was the World Health National Organization had declared anxiety at epidemic level. It's so widespread. And I think there's a lot of things in our culture, our environment, from blue light stimulation to just the busyness of our lives. And it's just, I think there are a lot more things, our food, there are a lot more things now that contribute to anxiety than perhaps in the past. And then, of course, the more anxious parents are, the more their kids absorb that. So I do really try to teach clients kind of to have a toolkit of things that they could do to, as we work on the underlying issues and resolving it in the nervous system, to kind of have a toolkit of things that they can do to kind of reset their nervous system to go from fight or flight to a parasympathetic rest and digest within a matter of minutes. And I think part of that is when they're in session or they've learned that, and they can say, okay, I was at a 7, 0 being no distress, 10 being the most. I was at a 7, and now I can take a few minutes and do some deep breathing, or I teach, we call vagus nerve activation, which is, kind of shifting into that parasympathetic. So maybe they can lay with their legs straight up the wall, or they can, implement some other quick strategies to say, okay, I went from a 7 to a 4. I went from a 7 to a 3 in just a few minutes. They develop their confidence that they can calm their nervous system, that they can get back to a place where they can then, have enough presence of mind to be able to observe their thoughts, their surroundings, choose their reactions, and get to a calmer state. Because as you know, it's a lot that is where the mindset piece, right? Like understanding the mind and what I'm saying to myself, and kind of reprogramming that and all that subconscious stuff, but they get so hijacked. And I think people that, for instance, have a panic attack, that becomes a trauma trigger, because then their body sensations, they feel that body sensation, and instantly they layer a bunch of meaning, and then they have anticipatory fear. They don't want to have the anxiety attack. They're not going to be able to leave. They're trapped in the movie aisle or the crowded space. And so teaching them to body awareness, and when you notice these sensations, here's some things you can do to change your posture, to activate your vagus nerve, to breathe, to shift your eyes in a certain direction. So when they notice that, okay, that body sensation comes up, what do I do with that to be able to calm? Then they realize it doesn't have to be a crisis. And over doing that repeatedly, they develop those strength in those pathways. It's kind of like that muscle memory. We do something again and again, and then our brain remembers, oh, here's what I do when that happens. And then it really gets them out of that crisis state. Does that answer your question?
Yeah, love that. And, putting your legs up the wall. I mean, it's not that difficult to do, but
Right.
when you're in that panic state, if you're just like, oh my gosh, I'm thinking panic, I'm feeling panic, I don't want to feel this way. Like, what can I do?
Right.
Go lay on the floor and put your legs up the wall. I mean, if that will help you, oh my gosh, how simple and cheap is that?
Right.
Right.
And I think depending on the scenario, like obviously if someone's at work, they can't go put their legs up the wall, or they don't want to do that. But there are other things depending on the environment that they could do, and noticing that when they change their body, it really does send a different signal to the nervous system. And so just, yes, equipping people to be able to be confident that they haven't lost control, that they're not crazy, that this is not they're not broken. I think that's really the main thing. And I know, I'm sure in your, reprogramming the subconscious mind, when we start to think that we're broken and there's nothing we can do, that's a very helpless and powerless place to be. And that signals our body and our cells to respond in a way. And so kind of helping to give some tricks to let them know that that's not the case.
Yeah, I love that you can control your response, and it's just a matter of learning how, right?
Right.
So
Absolutely.
with your work and with my work, you work more on the conscious mind, and I work a little more on the subconscious mind. And there's tools that you can use for both minds to get these type of things under control. And I know for me, one of my daughters struggled with this before I learned this type of work. And one of the things she did was biofeedback. And they literally hooked sensors to her body and said, see, when you think this thing, your heart begins to beat faster, you begin to sweat. Okay,
Right.
so now think this thing and see what happens and see how you feel. And it's really a matter of learning the tools to, how do I change this? And like you said, then it becomes a muscle memory. So if it starts happening, you're like, okay, I know how to deal with this. And pretty soon it can be gone. And that's so powerful, because it's something, I mean, I don't know the numbers, but there so many people struggle with. And why walk around with those anxious feelings, fight or flight, which also shuts
Right.
down your immune system, right?
Right.
So yeah, so share some more, maybe an experience with a client, somebody that was struggling that you helped, that you saw some big change and turnaround based on what
Mhm.
you were able to share with them.
Right. Well, I think what you said, I actually do work more with the subconscious mind than the conscious, because CBT, I think, has a role, cognitive behavioral therapy, but I think the subconscious is so much more powerful. And so, in terms of, I think that's the problem a lot of people have with anxieties. They try to think their way out of it,
Yeah.
and you can't think your way out of it. You can go through the body and through the subconscious, but it really is a lower brain process. And
Yeah.
so, in terms of one client, it's hard for me. Hadn't picked one before this call. So I'm thinking of a collective one client. And that person would be people who have had those adverse childhood experiences, like I said, and they may have not even noticed. It's not, maybe they don't have the that they can think about the time where they were terribly beaten or they were raped or abused, which, of course that's trauma, and I work with that. But what I find a lot with people with anxiety is that they lacked emotional attunement with the parent, that the parent was there, but they didn't really see them, or they didn't feel like they could go to that parent with difficult emotions of fear or sadness and be comforted. And so their emotional states are very overwhelming to them. And so one of the primary ways that I have seen people get help with anxiety is to learn to have a very compassionate response. And in that, some of that is with, like you said, the subconsciously held beliefs. What does it mean to have emotion, or what does it mean? But really understanding their instantaneous, their automatic reactions to having emotions, and being able to make shifts there so that they can be in their body, be safe in their body with their own emotions, their own experiences. So people will commonly say things like, but I was able to notice that I was feeling this and thinking this, and then I was able to shift that and have a different response, and once people become aware of that subconscious programming, or how their body responds, or what they instantly do when they start to feel tears, or what it feels like when their throat closes up, and that's actually an emotion that needs to be expressed, then they get freedom and they begin to feel their emotions. And although that's internally, I think what anxiety is, a lot of times people are guarding against feeling their emotions. And as a result, they're trying to control situations and avoid triggers because they don't want to feel what they're going to feel. They don't want to feel the rejection. They don't want to feel sadness. They don't want to feel anger. And so I would say that is something that people will often say, I'm just so much more aware of what I was feeling and able to respond to that in a way that it wasn't scary anymore.
Yeah, I like that. And in my work, I also noticed that if you don't allow the emotion to come up, that it can also cause physical pain. And
Absolutely.
we deal with that a lot, right? So it's like, if you don't let those emotions come, if you don't deal with things, it manifests in some way and some negative way. And so you want to be able to learn how to deal with and process what's going on in your life. And I had an experience just this weekend. I was out in our guest house. I was remaking the bed between guests we had at our house. And all of a sudden I started to feel a little anxious. And I thought, why am I feeling anxious? I'm like making a bed. What's going on subconsciously in me right now, right?
Right.
Started thinking about, okay, what am I subconsciously thinking about? What's going on under the surface? And I had just scheduled an event, a big event with a big speaker that I had done before, like a few years before. And it had gone well, but it was a lot of hard work, and it was a lot of expense, and it was a lot of stress. And because I had like booked something similar, it was like my subconscious like pulled back to that old memory and was like, oh gosh, this is scary. Remember this was like, right? And so thankfully I have some processes too. So I used one of my processes on myself, just like, calmed myself down, like everything.
Right.
Right. And I didn't even know that was a trigger in me. So we've got all these triggers that we don't even
That's
realize.
right.
We're going through the motions and all of a sudden we're anxious, like, what do we do? So I love that you have tools to help people to learn how to deal with this, and then also a therapy to transform it so it's not there.
Right. I love though that's such a great example, because like that, I'm sure your audience knows, but that mindset that you were able to notice that in your body and then reflect and then kind of go back, okay, what have I been doing today? What am I thinking about? What just happened? Like, what is that the symptoms make sense? That you weren't just anxious because every woman in your family has anxiety, and you weren't just anxious because you just have anxiety. Right? There was a reason, and you knew that your symptom made sense somewhere, and you were able to reflect on that, like, and make shifts in what you were thinking about. Like, okay, well, this is, and then the other point you made that I love talking about, because it goes right along with EMDR, is that amygdala that holds like overwhelming emotional memories. It is so wise. It is so on guard. And so if it looks like, sounds like, smells like, tastes like, it must be like, so, oh, this is a big event. That other big event had a few scary things. This is a different event. And maybe you're prepared in a different way than you were last time, but your brain's just going to go, danger, danger. Remember that fear. Let's reproduce that. And, 4th of July is coming up, that people are going to be going through. I see a lot of people around, with the, veterans and things like that, because fireworks, they're not scary, they're not dangerous, but looks like, sounds like, must be like, the body responds with that anxiety or fear reaction. So our brains are just so miraculous, and I just love understanding more about them and helping people understand how they can use their brain to work for them, rather than feeling like their mind and their brain is an enemy.
Yeah. And you talked about traumas, and I know the subconscious is timeless, right? So if something traumatic happens, sometimes we'll tend to say, well, it was 10 years ago, it was 20 years ago, it was 50 years ago. But still, there's trauma in the system from those things. So it's so important to work through past traumas to get rid of the triggers that could be causing this anxiety that people are experiencing.
Right. And sometimes that, the amygdala, if it's trauma, like there's a part of our brain that specializes in the memory called the hippocampus. And when traumatic memories come up, the hippocampus is offline. It's not involved in that. So that memory essentially has no timestamp. So when a true trauma memory comes up, and this is not to say that every anxiety producing thought is trauma, but if a true trauma comes up, there's no timestamp. So the person is not remembering, they are reliving. It's what we call an abreaction. It's in that memory network. Their body starts experiencing the same symptoms that they had at the trauma. Someone can even bruise. Like if someone was bruised during a traumatic assault and years later they process that and they are going through, they are feeling the exact same. So they are reliving, their nervous system is reliving that response in the same way it did at the time. So that's one of the things. And of course, this isn't something I do in my online programs, but in EMDR, you're reprocessing that so that the hippocampus can timestamp that memory, and now it's can no longer be activated in the same way, because your body now says, oh, that was 30 years ago, or that was 5 years ago. So yeah, it's just, there's so much to how our mind processes and the nervous system. And like you've mentioned, the body, that's such a big piece, like how, when things aren't processed, they find their way out, they find their way somewhere, and they settle in the nervous system, they settle in the body. We hold on to those things. So I love the work that we do. It's so fascinating, isn't it?
And what you just said, you can bruise by remembering a memory where you were bruised. I mean, the mind is so powerful.
It is so powerful.
Yeah. So I know that you mentioned you had a car accident where your son did some work, and I think there was also something with your daughter.
Yes.
What have you learned from working with your own family and struggles that they've had?
Yeah, that's how I got into EMDR, was my son's accident. But 3 years ago, our daughter had a brain injury, and it's something that you don't know until you go through it. And I know many people have dealt with chronic pain. She developed post-concussion syndrome. She had a lot of previous autoimmunity, but she had multiple concussions, and the last one just really debilitated her. And so my husband practiced functional medicine, and so we were kind of looking at people all over the world. He was listening to lectures of different people in different areas to understand physiologically what was going on with her, because of course the MRI showed that she was fine, but she couldn't get out of bed. She was in a dark room. And at about 10 months in, we got her to a genetic specialist who specialized in head injuries. He was a former cranial surgeon, specialized in genetics and getting the right supplementation to the cells when people could heal. So, and to make a really long story short, we're about, a little over 3 years into our journey. It's been a really long one. It's been very hard. But as I went and I was listening to him, at first I'm just there as a worried mom, just have been praying for answers and really felt like God would let us. He was out of state, flew there and had been waiting for an appointment with him. And all I can think about is my daughter, just hoping that he has answers and insight into what we can do to help her recover, because she's missing all of her teenage, experiences, the normal ones I had thought she was going to have. But after the appointment, as he started talking about the amygdala and the parts of the brain that I deal with trauma a lot, and he's talking about fight or flight, and he's talking about the inflammation in her nervous system, I'm like, oh my goodness. So this is my chronic PTSD and anxiety patients. And he says, yes, you have to figure out how to turn the inflammation out. They all have central nervous system inflammation. So I think that really, I went home that night, to our hotel room, thinking not just about her, but just like maybe some of the clients that I had gotten stuck with, and oh my goodness, could this have been play? Could this have been a play? So it didn't really change anything about what I thought about the brain, but it just expanded my understanding of, so I'm always looking through a trauma lens and a lens of emotional regulation and what happened in their childhood. And now there's this whole physiological piece, right? With maybe genetic vulnerabilities, and maybe someone's anxious because they don't convert vitamin D, and they don't get that into the cell, or maybe, so it's just really, so I think our trial has been heartbreaking as parents, but as clinicians, it completely changed my husband's practice, because he already did food sensitivity and stuff, and then he started expanding and he got trained in the genetics. So it really has just, and again, then just sensitized my heart in a new way for people with chronic suffering, because even though I had worked with people with chronic suffering my whole career, I had been blessed to not have chronic suffering myself, physically or mentally. And so going through that and watching how the invisible injuries of the brain and the mind just, change your whole life, and how stuck and unseen people can feel in that. So I think on just multiple levels, that journey has just transformed, our practices and thinking about the ways we help people. And then too, I had never had anxiety, and now all of a sudden I have a sick kid and I don't know how I'm going to work. And, just really, really fearful, really for the first time in my life. And so really then having to go, okay, what do I teach clients to do? What do I know to do? What do other people, and really putting that into a system and developing daily practices to detox my mind from that stress and be able to kind of keep it together and just help myself in the way that I know to help others. And so transforming that into a process. So that was probably a long answer to your question, but
I love all that. So I know that people can work with you direct, but you also have an online course. Like, what are the modules in it, and what do people get from it? What do they gain and learn?
Right. Okay. So yes. And it's pausing a little bit here, so I hope we don't cut out. It's the anxiety reduction method is my course. And it's kind of when I started realizing the stress was really taking a toll on me, and I started developing my daily practices of, detoxing stress. So the first one is calming your nervous system. And we work through vagus nerve activation in the body, and like working through somatic experiences to kind of calm the nervous system is in module 1. And then in module 2, we go into really identifying causes and kind of that mindset, like you were describing, when you were able to reflect on what are the experiences, what are the thoughts I'm having, what's going on in my body, what's going on in my environment, and kind of peeling back the layers to this anxiety makes sense somewhere. Where is it? Where can I make shifts? And then we move into emotional regulation, which is kind of what I mentioned earlier about not being scared of our emotions and being able to feel those in our body and experience those in our mind and express them in healthy ways and really develop self-compassion and emotional regulation. And then the fourth module is on connection to yourself and others. And so there's a lot of boundary work and being able to know what's mine and what's theirs, because anxiety feeds, or relational trials feed so much anxiety, I think, especially in women. So the online program is for women. And then we work with women or men in a one-to-one or coaching capacity, but the online course is for women, the anxiety reduction method.
Perfect.
And then individually, if people want to come in, we work with them individually, and they can, if they want genetic testing or food sensitivity testing, that can be a part of their package as well.
That's awesome. So on the women, what age women? Because I'm thinking teenagers, can they get into this women group, or is it really more for adults?
There's nothing in the program that would preclude a teenager from doing it, because my practice has been primarily adults. In office, I see pretty much 18 to, 55. Really, probably most of my clients are age 35 to 55. So a teenager could take the course. I've invited some, young college girls into it. And so there's nothing that would not be helpful for them. There is a Facebook community as a part of that group. And I know young people don't use Facebook community as much.
Too cool for Facebook. We know that. Yeah.
Right. So, yes. So, I think some of the things around boundaries and some of the content there, it's not mature in content, but it might not be things that they've really discovered in their life yet.
Yeah.
So, yeah.
Be helpful to learn.
Right. I wish I'd learned that stuff in college.
Before, shoot, now I'm learning this the hard way. Yeah.
Right.
Well, your course sounds amazing. So I hope that are listening, jump on the link that I'll share with this video so they can check out your course and get your course and start to transform their anxiety, because there's no reason to live in an anxious life and an anxious body and an anxious mind. We have so many tools nowadays with all the modern science, everything that we've learned, that we can take those tools and we can help ourselves live our very best life. So I'm so grateful you were here today to share some of your knowledge and wisdom with my audience. And I'm excited for your course, and I'm excited to check it out and share it with my own family as well.
Thank you.
Any last thoughts that you want to share before we sign off today?
I would just encourage people to just what you said, to know that they don't need to live like that. And whether it's free resources online or if they can do a course, my course does have a live teaching component. So I teach live in there every 2 weeks. So it's kind of like a done with you. But, if it's books, if it's online resources, if they want to go a step further and do courses and coaching, that it's just really, I think the message that I would like to give people is that you're not bad or broken or weak, and that you do have the power to heal. And I think too much of our society just says, well, that's just my anxiety, or that's just, I'm just made that way. And we have to get away from this thought of there just being this random chemical imbalance that you're just destined to live out your life that way, or just take a pill. We weren't born with Xanax deficiencies. I'm not saying that, that no one can ever benefit from that, but I'm saying that's just really not usually the cause of anxiety. And so just to have hope that you can absolutely heal. Brains are constantly being, because of neuroplasticity, all the stuff that you teach, like our brains are, they're able to heal, they're able to grow and learn new things. And so I just encourage people to not stay stuck.
Awesome. Thanks for being here today. It's always a pleasure.
Thanks, Jenny.
And I hope people jump in and take advantage of what you're offering to create their very best life. So thank you again.
I'm so glad we connected. Thank you, Jenny.